So Barrett's disease, otherwise known as Barrett's esophagus, is what we call a metaplastic change to the end of the esophagus. Now, this usually happens due to acid that comes up from the stomach, otherwise known as heartburn or reflux disease. It comes into contact with the esophagus and changes the underlying tissue. This underlying tissue changes from what it normally is, what's called squamous or squamous tissue, to more glandular tissue. And normally, and for the vast majority of people who have Barrett's esophagus, it's just a knowledge that you have it. We generally screen people who are 55, smokers, because those are patients with the highest risk of it. And it does carry a small risk of developing into esophageal cancer. So Barrett's esophagus, once it's diagnosed, is surveyed depending on the type of Barrett's esophagus. Now there's three types based on how many changes there are. So if there's what we call non-dysplastic changes, which are non-cancerous changes or non-precancerous changes, then we follow those every 3 to 4 years. If there are cancerous changes, either with low grade or high grade, so low grade, there are changes, but not so severe. High grade, there are changes, but a little severe, closer to cancer. Then those are the patients who we don't really just survey. We don't follow them every couple of years, but then we may ablate the tissue. We ablate the tissue by burning it using thermal energy. In endoscopy, a procedure through the mouth where you come in the morning and you leave a couple hours afterwards after you're feeling well. And we basically burn the tissue and cause it to change back to the squamous, to the normal tissue. So once again, it's a metaplastic change from acid exposure. It's something we survey to prevent the development of or progression to esophageal cancer. It can be treated with thermal energy, or in some cases freezing energy, but it can be ablated and reverted back in those more high-risk patients. And the whole goal of following it is to make sure that we catch any cancerous changes early on so we can treat it endoscopically or minimally invasively surgically. So Barrett's esophagus is an important thing to know if you have it. Don't be afraid if you have heartburn thinking that you do have it. I'm sure it can be detected on a routine endoscopy, and your physician will screen for that if you have long-standing acid reflux or a family history of esophageal cancer. It can be treated. Most of the time it's surveyed and doesn't need to be treated. But in a nutshell, that's Barrett's esophagus.